therapists from the Energy Source. We are a multidisciplinary children's center in Bangsa. And this is Stacey, our speech therapist.
I'm from the UK, working with alongside Nurul at the Energy Source. I'm new to the team. I've just joined. I've been here for 2 weeks.
2 weeks?
Yeah. But I've been in Malaysia for quite a while.
Yeah. So we're here today to answer some questions from you guys regarding autism spectrum disorder and
I think we got a lot of questions from parents, didn't we?
Yeah.
With regards to working with children who are on the spectrum. So we just kind of thought we would take some time together.
Yeah.
Because it's very rare that you'll get us together because we're both very busy. So we thought we'd take some time together just to kind of try to answer some of those questions
that you guys have. Yeah.
Yeah. So do you want to go first? Do you want to delve in?
Yeah. So I'll just give a brief on what occupational therapists' role are with children development. So occupational therapists, we work with children. In a way, we help them to master their daily activities.
Mm-hmm.
So when you think about children, when we talk about children, their daily activities are usually playing, learning, as well as maybe a few self-independent skills. So like eating, toileting, wearing their own clothes, those kind of things. And and then as for speech therapists,
so for speech and language therapy, then we work on, especially the children who are on the spectrum, we work on functional communication primarily, and functional communication. Sometimes that would be verbal, sometimes that would be non-verbal using some devices or things like that. But really, we're working on the whole communication skills, working on understanding language as well as expressing language. And like I said, we use kind of multimedia approaches for being able to express the language and the communication.
Yeah.
We work very closely together, and so a lot of times the children that we see, we kind of, we'll see them separately, but we both see the same children, and so we have to kind of align our goals, don't we?
Yes, exactly. And then despite having the same goals between occupational therapists and speech therapists, we have different approaches to reach that goal. So yeah. And how does your speech therapy sessions usually look like?
So typically, it really depends on the child, but typically with younger children, then a speech therapy session would tend to be on the floor. I have a beautiful play mat that I kind of, tend to use to be crawling by the floor, and it's very kind of play-based. I do really emphasize a lot of kind of play-based therapy. Yeah. These days, I don't know about you, but I find a lot of the kids that I work with, they're not so exposed. There's a heavy focus on younger children doing academics.
Exactly.
And they don't get exposed to all these toys and games, and it's a lot of flashcards.
Mm-hmm.
I don't even really use flashcards in sessions to elicit words or anything like that. It's kind of really, primarily it's play-based.
Mm-hmm.
So yeah, most of the time, younger children, my session would be on the floor, and we'll kind of take turns. I'll have toys and games that I know the kid likes, or that would be quite stimulating for them.
Yeah.
In terms of, there might be some visual aspect, or maybe a sound, or we have a lot of cause and effect toys. So my little barking dog, where you push some bones and then he jumps. The kids love that, but they love to see my reaction.
Yeah.
I'm the one who jumps.
Yeah. But again, seeing our reaction would also help them to learn something as well.
Yeah.
Emotions, what to say, labeling emotions.
Exactly. It's like, oh, Stacey's so scared.
Yeah.
And then I do a scared face, and then they learn that emotion. They learn, okay, that's what it's like to be scared.
Mm-hmm.
So we build up the communication skills and just awareness, and just with those kind of play skills, which is quite nice. And I know occupational therapy does quite sort of similar things in your sessions sometimes.
Because play is the main occupation of all children, and then we try to use play to achieve all of our goals. So for say, let's say the child comes in, and then they would have some maybe delays in physical maybe crawling, maybe climbing, or some difficulties with their fine motor, and then we can achieve all of these goals just through playing. Yeah,
which is awesome.
Yeah.
Yeah.
So you can see when you can expect a lot of playing and fun in our both occupational therapists and speech therapists.
I think we always try to make it quite fun so that the kids enjoy it.
Keep them engaged.
Yeah, I think if I have a child who has occupational therapy and then they have speech therapy straight after, I'll ask them what they did in occupational therapy. Like, oh, what did you do with teacher whoever?
Yeah.
And they always tell me play.
Yeah, it's always play.
Yeah, they don't even realize that they're kind of learning or acquiring these new skills.
Yeah.
To them, it's just play, which is a really good sign. It means that they're really enjoying it.
Yeah.
And they get more out of it. Right?
Exactly, because it's playing is their most main occupation. They're always very engaged in that activity only, and then we can try to modify and create a lot of activities that consist a lot of the things we want to work on with them, a lot of the skills just to play. So that's why we're like all the children therapists are all advocates for playing with your child, let the child have their time to play during their childhood, because these are the prime time that we can fit them with the most skills. Yeah, just to play. Yeah, and that's a lot of playing words in that. Yeah,
I think we probably want to highlight, like when we're talking about this, we use proper, genuine toys. We're not necessarily using gadgets and devices.
Yeah,
there is a difference between kind of giving your child an iPad, and it's okay if you're playing an educational game on an iPad. That's not really enhancing your child's communication skills on my part. I don't know, like in terms of occupational therapy, how, if it does really help. To me, I find it's overstimulating and there's no two-way interaction, so it's not good for communication skills.
A lot of the times we try to get the child to, human to human interaction is the most effective way for a child to learn. And then when for example, if a parent were to play with their child, they get to have a relationship, and the parents can be more in tune with the child rather than the child having a lot of screen time. There are a lot of things like educational applications out there, but it's not the same as having human-to-human interaction.
I agree. I really do agree. And so, just to kind of drive that point home, so when we talk about doing play-based therapy, we are talking about actual toys. This is one of my favorites, are books, actual books, and not e-books, like actual books where you can turn the page, and we've got some sort of sensory books and things. This one's got some nice holes, and using puppets and different things. So not using our gadgets, but using actual genuine real toys.
Yes, and on top of that, giving children a lot of opportunities to go out and experience different sensory experiences outside, playing on the grass, going to a forest, going to the river. That gives them a lot of opportunity to play, and as well as developing in different environments. Yeah,
I agree. Yeah. Unfortunately, because of the pandemic, that's not really been possible this year, this whole year, right? So I guess we're probably going to see some children who have a bit of delay in those sort of skills, right? Just because of the fact that they won't be exposed. They can't be exposed.
They don't get the sensory.
They're missing that. Yeah.
But that's all right. Over time, we'll try to work on it as well, and then the parents will try to work on it as well.
Yeah, and I think now that things are kind of opening up again, then we're able to kind of go back and sort of do these things and explore a bit more. If you're lucky enough to have a garden or a playground in your condo here, then at least now they're kind of open up, so you get some of those experiences, right? Yeah. And
there's a lot of places out there opening up, like super park, playgrounds. Those are some of the places that would that your child would benefit from as well. Yeah.
Nice. So we have a question, which is, how long before we'll see any results?
That's a tricky question, because every child, they have different, when they come to us, they already have different set of things that they already know, and then the things that they don't know, and then when they come, we would usually do an assessment to see where this child is and where this child's level is at, and then from there we would be able to determine where what are the goals that we want to work on with them. And then I feel like one of the factors that affects how fast a child would be able to achieve the goal is what parents do at home.
Yes.
So if the parents collaborate with the therapist as a team, and we're working as a team, and then we're monitoring how he is at the clinic or at school, at home as well, and then we would be able to work together and achieve that goal even faster. Yeah. What do you think about that?
I completely agree. One of the difficulties that I can have, and I do sometimes see, is when a parent kind of drops their child at a session, and doesn't really engage very well, or like with us, or they don't really kind of seem to take an interest so much, and then you don't really see, they complain about slow progress. But the reason for that slow progress is that you're not following through. We're giving you this homework to do at home, but you might not be following through on it, or you're expecting helpers or something, maybe don't have the English skills to do these activities that they don't know what they're doing. They're not necessarily teachers or therapists themselves. But they kind of expect us, I always say this, I don't have a magic wand. I can't wave a magic wand and fix your child.
Yes.
It takes a long time, it takes a lot of work, and it really does. We work as a team, we work very closely as a team, and we do expect the family to really engage in part of that team, and be part of that team. It's really important. Yes, I think if you do have that wonderful kind of network, which we do have with some of our kids, which is amazing, you can see such good results, and you do tend to see faster results.
So when everyone in the team works together and try to utilize the strategies that we share with the child, that's when we would be able to see enhancement, like the child suddenly flourishes in all the environment.
And it generalizes into everything, right? So that you get really good reports of the child at home. They're doing this. They're now they're going to the toilet by themselves at home, or they're sleeping much better because they're doing X, Y, Z. They're communicating at home. They're communicating in OT. They're
with their team, with their teacher as well. And then
for me, they're sitting so much better in my session. They're not kind of running around, and I don't have to prop them so much. So it crosses over, and that's why it's really important for us to work as a team. And it's really important that everything that we do in the centre is followed through at home, right?
Yes, exactly. It should be followed through at home, just to have the strategy generalized all throughout where different environments that the child goes to.
That's right. I completely agree. We do tend to be on the same page for a lot of things.
So one of the questions also said, one of the parents asked if they need to see a developmental pediatrics before coming to seek for therapy services.
And I usually say no, but I will always ask the question. I'm not sure about you. They don't necessarily, for me, they don't necessarily have to have gone through the developmental pediatrician route. They can come if they're concerned about the child's speech and language skills. They can come and get that assessed. And if during that assessment I noticed, okay, they're not really following instructions well, they're at a certain age, like maybe they're 5 years old and they're not dressing themselves, they're not toilet trained, then I would or they seem to have a lot of sensory difficulties, sensory processing difficulties, then at that point I would probably suggest seeing an occupational therapist. And also I might just ask, have you seen a developmental pediatrician? Or if they are that little bit older, like 5, I might say, maybe have you seen a psychologist who can also, do sort of assessments to determine if it is something like autism, or if there's something else happening. But you don't need to have gone through that route to come and see us.
So
you can just make your own referral, right?
Usually we also have parents who came in who just flagged something. My child is not meeting this milestone, or they're just different. I feel like they're a bit delayed from their peers. So they would come in into the center and we would start with looking at the child holistically, looking at all of their developmental areas, physically, fine motor, emotionally, communication as well. And then that's the thing about having different therapists in the team.
Yeah.
We would be able to refer my client to you and then ask your opinion as well. What do you think about this child? And then work on together from there.
Yeah. And if we're really lucky, then we can see the child together for the kind of initial consult. So then we can kind of, both sit in, or maybe there's a team of us who can get to sit in together. So we're all observing the child, we're talking to the parents, but we're all observing different aspects. So then afterwards, then we can kind of discuss together.
Come together. And
and like I said, with that, using that holistic approach, and then kind of from there we can be like, okay, we think the child might need to do this, or this. And then we kind of speak to the parents and move forward from there.
Yeah, that's usually how it is over here in the energy source.
Yeah, which is quite a nice system.
Yeah.
So kind of following that from that one, so actually this is for me, I'll ask myself. Ask myself this question as far as you. But it just says, is it necessary to do a hearing test prior to accessing speech and language therapy? I always say yes. It's really, really important to rule out any hearing difficulties. It's one of the first questions I'm going to ask when you come for a consult with me is, have you had the hearing tested? When was your child's last hearing assessment? Are there any hearing difficulties? Because that of course would have a huge impact on the therapy and the delay that they're having, how we're going to do therapy with your child. So that question is a resounding yes. Please, definitely have your child just to rule it out. That's, at the end of the day, even just to rule it out, that there's no hearing difficulties. So to kind of follow up from that, do you require, so we do require hearing assessment, I certainly do. Do you require any kind of prior assessments or anything like that before you can work with a child? Or
not exactly. So when occupational therapists start with the child, we usually want to know what the child medical history, maybe birth history was like, and if the child has gone through visual tests or hearing tests, that would be a bonus. But there is no necessary test that I would say an occupational therapist would have to look into before we determine if the child needs a therapy or not. Those kind of things.
Interesting. So again, it's slightly different but quite similar.